Okay, in this video I'm going to demonstrate how to get credit for educating your patient on your meaningful use criteria. So first of all, let's show you how to get some credit for educating patients on smoking cessation. There are several areas where you can do this. Probably the easiest one would be here under the cogwheel that's on every field. And if you go to tobacco cessation discussed, you'll say yes, and then you'll pick which sort of information you gave to the patient. Smoking cessation education, for example. You'll add it, and you'll save and close, and that gets you a point on that visit. Another location where you can do this is here under the finalize under tobacco cessation. This is similar to what we had previously. If you want to go into more detail and use this one, you can actually get a small amount of RVU for your education. So you've got to go and fill out these areas here. For example, we'll say history of tobacco use. We talked about triggers and cues, support programs. We gave the patient a prescription for some Chantix and counseling. And the end outcome would be no longer using tobacco. Follow-up outcome would be no longer using tobacco. And then you have to go up here and select your diagnosis, come down to the bottom, select more than 3 minutes. It has to be more than 3 minutes, so 4 minutes. Submit to Superbill, and that's it. And then you can exit out, and you'll see up under your Superbill or your charges here that you've got a 99406 for 3 to 10 minutes of smoking cessation. Okay, so that's another education area. Now let's go number 2, second place where you can get points for education. When you are finishing your note and you're under your assessment and plan, if you go to the Mind Plan area and you choose a diagnosis, let's add another one here. Let's say GERD. Okay. So under this, you'll add instructions. And now I've populated these and saved my order set. If you want to change them, all you have to do is change what's written here by typing something different and then save the order set. And it will save it for the diagnosis group listed here. Okay? So if you select your diagnosis, select your instructions that you educated the patient with, and the last step is place the order, your check mark goes away, and save and close. And you'll see that this information now comes underneath your plan for orders. So that gets you a point. The last place where you can get a point is with children. So I'll pick a pediatric patient here, and we'll create a new encounter. Select your specialty as pediatrics. We'll say it's a well child visit. Now these are on well child exams. If you go down to your assessment and plan, at the very bottom there will be this well button or well visit button. This is where you do your anticipatory guidance, and you can pick any of these: diet, safety, education. You have to place the order so the check marks go away. Well, in this case they didn't go away, but you have to place the order and then save and close, and that will get you your education credit. So if you go to order management, you'll see that it's been placed for age-appropriate discussions of education. So that's the third area where you can get credit for these education numbers. Moving forward, we're going to have to be better at our education for meaningful use than we had been last year. So work on this to try and get your numbers up, and feel free to comment below or ask me any questions in the office for details. Thanks and good luck.